everyone. This is Dr. Wes and Bonnie, our resident expert dietitian, and we're just here today to talk about a few issues and a few topics that Bonnie usually comes into contact with and I usually come into contact with. So thanks, Bonnie, for your time.
No, not at all. Thanks for having me today, Wes.
So we're talking about, I thought we would just start talking about medication and lifestyle and, what is your experience with medication with regards to high blood pressure and cholesterol and what needs to be done?
Yeah. So that's a really good question. I do see quite a fair amount of patients that come to me with a large, maybe a large list of medications. And yeah, usually things like high blood pressure and high cholesterol. Sorry, I went blank.
And yeah, I mean, I see that too. I see that quite often. And my experience is that as these do improve, like the cholesterol levels improve and the blood pressure comes down, that we do have to adjust them. And what about you? What's been your management and what's been your experience around that?
So I work closely with diet changes as well as lifestyle. So diet plays a fundamental role in, the ability to provide nutrition. So with good nutrition, I find that patients can lose weight a lot easier. And with that, things like their cholesterol and their blood pressure markers tend to come down as well. And as a result, they do need to monitor their condition, and most of the times their medications will need to be adjusted. That's where the dietitian and the doctor work closely together to make sure the medications aren't too strong for the patient. And it's just a really good way to wean them off eventually.
Yeah, I think so. And certainly I was just saying to someone before that those patients that do the lifestyle and don't just rely on the medications seem to have a better outcome. And that's what we should be encouraging, that people have better lifestyle, able to eat better and sleep better and exercise, manage their stress and manage their relationships better. So I'm all for that. And what about digestive issues, Bonnie? Like what's been your experience around that?
Yeah, so I tend to see patients who might get referred by their GP for digestive issues like abdominal cramping or diarrhea, constipation, or excessive flatulence. And some of these patients have been on a restrictive diet for a long time. For example, the low FODMAP diet, just to manage symptoms. When it gets to a point where being restrictive isn't helping with their symptoms, it's important to investigate a bit further, because there could be other causes of why they're getting these digestive distress. So, for example, sending my patient back to the GP to get further testing to see if it could be potential a parasite or a gut bacteria that hasn't been looked into. But yeah, there are different reasons why someone could have digestive problems, but this is where the collaborative care comes in to make sure we're treating the cause and not just symptoms.
Yeah, I think so. I think because two heads are better than one,
Yeah.
as they say, and I think sometimes, especially with complicated cases, which is what we tend to come across, it's better to have a number of practitioners that are involved. I also, with abdominal issues, often it's got to do with gut bacteria, and so testing for using a complete digestive stool analysis is a good way of going. And That way we can assess as to what the balance of bacteria is like. Yeah, and are there any specific treatments that you use for those sorts of problems, like the pain and the diarrhea, constipation, flatulence? It's mainly dietary with you, is it, Bonnie?
Yeah, so diet does play a huge role in managing symptoms as well. But I guess from the testing, it's important to know what is the actual cause. So, like you said, if a patient has completed a comprehensive stool analysis, we would use this information to see if there are an imbalance in gut bacteria, and then usually there is some degree of imbalance. So we would want to try to remove the bad bugs and try to repopulate the good guys. And this can take some time. We do have a good protocol for that. So it incorporates a diet that really starves off the bad bugs and allows your good bugs to fight back. And also treatment.
You're referring to the gut rebalance program?
Yes, I am. So, and yeah, it involves incorporating antimicrobials and antibacterial agents just to help balance the population back. We find that a lot of these patients do get really great results after going through the program. It is much better than relying on a restrictive diet for long term.
And so, what sort of diet or what sort of nutrition do you think is best, Bonnie?
Nutrition. So, a really good one is to avoid refined sugars. So, a lot of these bad bacteria love sugars, especially your sugars in the ones you add in your tea and coffee, or just processed carbohydrates, things like your wheat products such as your breads and pastries and croissants. So it is quite an extensive amount, but really our main goal is to really try to starve off these bugs, and they do love these carbohydrate and sugary rich foods. So yeah, these will be the main ones, just avoiding certain ones and incorporating a lot more vegetables and some good quality protein and fats. So at least your body's getting the right nutrients while we heal your gut.
Yeah, good one. And you've raised the topic of weight loss plateau. What is your management in that sort of situation when people plateau in their weight loss?
Yeah, I do get a few patients come to me with a history of yo-yo dieting. So they've spent quite a bit of time researching and trying different types of diets. So what we do is in our first consult, we'll sit down and get a bit of a background in all the things they have tried, as well as look into their medical history, and as well as their dietary habits as well. So these are very important. And looking into the blood tests as well. So if a patient is coming to me with a weight loss plateau, I need to do further investigation, like what is actually happening. Have they actually caused metabolic damage by restrictive dieting for a long period of time? And this tends to happen when patients have been on a low calorie diet for a long time. Their metabolism just plummets and they're unable to burn energy as efficiently as before they were cutting calories. Looking into their thyroid health, so our thyroid controls our metabolism as well. So our thyroid is a good indicator if we've been doing some restrictive dieting as well. So, and also further blood tests like insulin resistance or elevated cortisol levels. So it's a bit more of a holistic approach, and it's not just about telling you to eat less and move more. It definitely is a collaborative care with your GP and your dietitian.
Yeah. And I think you've also mentioned sleep apnea before.
Yes. So sleep is fundamental in human physiology. We do need adequate sleep, especially good quality sleep, to help regulate our hormones. So people who don't sleep enough can find that they're more hungry during the day. Their hormones are a bit imbalanced, their blood sugars are a bit all over the place. So yeah, just getting the fundamentals of sleep down will make a big difference in weight loss.
Yeah. So obviously, it's once again, it's a holistic lifestyle approach. And are there any like special dietary tips or tricks that you use in people that have had weight loss plateau?
Yes, definitely. It's about looking into how much calories and how much food they're eating at the moment. And more often than not, they're severely under eating, or they're just eating the wrong types of foods and feeling like rubbish.
Mm.
So it's about getting that behavior to change and incorporating really fresh, wholesome foods to start nourishing the body, because we want to build the metabolism back up and not and make sure the brain isn't getting the signal of starvation. So I would look into removing certain foods that might trigger some people, and just incorporating, fresh produce that will make them start feeling better.
Are there any, like you just mentioned, foods that trigger? What are like some of those foods that would really trigger someone?
Well, everyone's an individual, so someone might be triggered on bread, for example.
Yeah.
So just have this simple bread, and they might need 2-3 slices just to feel satisfied. Or for someone else, maybe refined sugars like a brownie. So if they are unable to control themselves after one brownie, maybe that's something we should really look into.
Yeah. Okay. So is there any, like in those situations, what do you do to replace the brownie or replace the bread or?
Yeah, so again, it's really patient tailored. Some people want to go, just cold turkey and just cut it all out. Otherwise, it's all or nothing. And some people need a slower transition to wean themselves off. So I might give them a bread alternative. So something maybe lower in carbohydrates and made from like nut flours instead of wheat flour.
Right.
For the brownie, perhaps a natural sweetener rather than processed white sugar, and just good ingredients just to satisfy a sweet tooth. But working through that trigger, being triggered, it's something I'm here for. So patients can talk to me about, what they want to achieve, and if sugars is something they want to tackle.
That's great, Bonnie. I thought we'd just talk a little bit about some other issues like saturated fat and eggs is a big one. Like, low fat diets. So in your studies, like saturated fats, what's your take on them?
Yeah, so a lot of most mainstream healthcare professionals, we learned that saturated fat was very bad for our cardiovascular health. So that saturated fat was a huge risk for heart disease. So now we know that a lot of these studies were actually quite, I guess, not that reliable. They were 50, 60 years old, and a lot of them were cherry-picked. And with that, governments did utilize this data and prescribed it to a wide population. And that's why we have our guidelines today. But the more studies we have now, it shows that saturated fat is not linked with causing heart disease.
Yeah.
Yeah, so those studies aren't really reliable. So yeah, especially I guess you have to look at the literature quite critically. You can't just just look at the abstract and think it's all good. But things like, is it on animals, or how big was the population size? So it does take a bit of time to actually go through articles, but
which can be quite confusing for the layperson. I mean, let alone the medical professional, where I think it's it's difficult. There's a lot of, the information is not
Mm,
necessarily that easy to find out the answer,
yeah, yeah. I guess questioning what you've been learned and what you've studied for such a long time, it can be difficult for a lot of healthcare practitioners. But I guess you have to really look at the literature and really decide what is best practice for your patients without being, influenced by big corporations and food industry. Yeah, but it is known that saturated fat is fine to eat, safe,
know?
pretty much.
Yeah, yeah. I think I've, well, obviously in the last few years, even 5, 10 years, I've been looking more closely at the literature, and it's sort of really made me question about what we've been taught. And I don't think there's not there's not a clear cut answer, because science always changes, and we need
Yeah,
to keep abreast of the science. But yeah, I think that's where we just need to keep learning and keep asking questions and keep refining the way that we practice. So the big question is, Bonnie, how many eggs can we eat per
yeah. So,
day or per week?
so this is a pretty common question as well, um, because eggs contain cholesterol, and a lot of people have been afraid of cholesterol for so long. But recently, it's been found that up to 12 eggs per week is safe, even with patients that have diabetes um, or at risk of metabolic syndrome. Yeah, 12 eggs a week is fine.
Yes, very good. There was a recent study that was just released. I think it was an Australian study, wasn't it? And
Yeah.
yeah, which showed 12 eggs per week was safe. And what about eating low fat, low calorie, and not losing weight? Can you tell me a little bit about that?
Yeah, again, because of this this fear of fats, and especially saturated fats, a lot of people tend to gravitate towards more low fat products, and that's where food industry kind of brought out all this brand new low fat, margarines and vegetable oils, low fat dairy. So people have been buying these thinking they're actually good for you, but unfortunately, in order to make a food palatable, you have to take the sugar out. I mean, you have to put the fat out and then replace it with sugar to make it more tasty. So um, people who think they're trying to lose weight by choosing more low fat products, they're not necessarily losing weight, because these foods are high in carbohydrates and sugars, and it causes more of a hormone effect that makes you gain weight more than just calories themselves.
Yeah, yeah. I think that's been the thinking. It's interesting to see how the thinking has changed over the last 20 years. I remember when I was in my younger days, it was low fat, low fat, low fat, but now it's turned around and we're seeing more full fat, and I think
Mm,
it's
good.
it is healthier. And another question is that you've probably heard is, should people be taking a multivitamin? What are your thoughts on that?
Yeah, so our food isn't the same as it was 50 years ago. So there's been a dramatic change in the way our food has been produced to feed millions and millions of people. So the nutritional content of food isn't as great. Um, so I think a multivitamin can be a good idea. But not just a multivitamin just over the counter. So, so these vitamins do contain synthetic forms and not really good absorbable forms. So I would recommend speaking to your doctor, speaking to your dietitian to make sure what your intake is quite adequate, whether you're actually absorbing your foods properly, and if need be, then maybe supplement with a practitioner only type of nutrient or vitamin.
Yeah, I think you're right. I think certainly there's been some studies that show that once food has been put in the fridge for a week or so, like the nutrient content is literally zero. So taking some sort of nutritional supplement, I think, is advisable in this day and age, particularly now that all our food tends to be grown elsewhere, and then the whole transport process probably depletes the amount of nutrients in the food. But yeah, then there's this whole debate about what forms of nutrients are appropriate, and I think, well, once again, it becomes quite technical and quite complicated, and probably the best answer is to see your health practitioner and get your individual health sorted, because everyone's health is different. What is the best cereal or bread to eat?
Yeah, so most cereals and bread are pretty much the same thing. So they are different variations of very similar grains. So don't let marketing and the labels fool you. But generally, I wouldn't recommend my patient to start off their day with a breakfast cereal or breads, and especially if they have gut issues or poor sugar control, or they're not very active as well. So there are different factors to suggest why I wouldn't recommend grains for breakfast. But yeah, I guess if someone really wanted a little bit of bread here and there, maybe a little bit of organic sourdough if they really need to, in small amounts, but depending on how their gut health is managing.
Yeah, I think once again it's a bit of an individual choice, isn't it? And one last question in closing, Bonnie. What's your thoughts about fruit and whether patients should be eating fruit?
Yes, I think fruit is very good for everyone. It becomes a problem when someone overdoes it on the fruit. If they have, say, a big bowl of grapes in front of them, or heaps of watermelon, and they can overdo on fruit, because remember, fruit is naturally high in fructose, nature's sweetener. But yeah, I think eating the whole fruit by itself, not juicing it, is the best choice. Eating it with the skins, the peels, really good for fiber. But yeah, fruit has a lot of vitamins and minerals, depending on obviously how it was produced and grown. But yeah, I think incorporating fruit every now and then is fine.
And I always say seasonal fruit is probably the best, and seasonal vegetables too, I think, for that matter. But yeah, the large majority, I think, of what people should be eating is vegetables. Vegetables.
Exactly. If you're getting a wide variety of vegetables, you don't necessarily need to get your vitamins from fruit.
Yeah. So I think vegetables, 70% or so, 70, 80%. Anyway, so I think the take-home message is, well, they say 5 servings of vegetables and 2 servings of fruit per day, don't they? Something like that.
Yeah,
the current
there's no
guidelines.
Actual scientific base for those numbers. Again, it's been said that it does benefit a lot of the food industry again. So as long as you are incorporating a large variety of vegetables and small amounts of fruit, it should suffice.
Yeah. Very good. Well, thanks for your time, Bonnie.
Always, Wes. Thanks so much. It's been really good.
Yeah. So we'll sign off for now, and we will chat again shortly. So for those in the Merge Health audience who've been following us, click the like button, hit the subscribe button, and we will catch you soon.